Hello, everyone, and we are live again. And this is a Sunday. Good morning to all of you. And we have Dr. Gaurang with us, and he'll be joining us shortly. And I hope all of you are excited for this session, and we have been promoting it for so long. And it's a very interesting topic he'll be teaching us. And let me introduce him shortly. He'll join us in as well as a wonderful teacher. And he has been teaching the homeopathic community and being so young and and being this good, it's very important for all of us to learn a lot of things every day. So today we are learning about autoimmune disorders. Welcome, sir. Good morning.
Hello, I'm happy to be here.
How are you, sir?
I'm always good, always.
So thank you so much for accepting this invite to be a guest speaker on our platform, and I'm very glad that we could have you.
With pleasure.
So today's topic is autoimmune disorders. So you have another series on autoimmune disorders. I saw it's coming shortly,
Yeah,
right?
yeah.
So,
So yeah,
first,
it's true.
yeah. So we'll start our questions after Dr. Gaurang gives us a little introduction about this topic.
Yeah, so this is a kind of a very important topic in today's times because if we see around us, the autoimmune disorders, the hormonal disorders have been increasing rampantly, especially in the last decade or so. This also has to do with our lifestyle. It also has to do with our food habits. It also has to do with the kind of stress that we all live in. It also has to do with our sleep patterns, our circadian rhythm. It also has to do with certain allopathic medications that we are used to. It also has to do with certain vaccinations. So it's a multifactorial thing. And with this, it's so common in today's times, the autoimmune disorders. And ranging from venous granulomatosis to uveitis to ophthalmic cases to Henoch's Nolan purpura to kind of a rheumatoid arthritis and so on. So this is very common, and I've been traveling different parts of the world to teach and also to see patients, and the number of patients have been increasing a lot. The good part here is that becoming more educated about what is autoimmune disorder and the type of autoimmune disorders and the kind of hormonal disorder. And they also realize that the real solution of it is not in one particular treatment, let's say an allopathy or certain type of immunosuppressants. So the real treatment changes in the lifestyle, especially changes in a person's overall kind of sleep patterns, food habits, and especially focusing at the root cause. And of course, finding a very good deep. So I think all in all, when you look at it in such a way, I believe homeopathy has a huge role. And and of course, because this is such an important topic for our colleagues, um, and and we have the Academy of Classical Homeopathy that we are kind of conducting courses and seminars in different parts of the world. So the new course that's going to start in December is based on that, on autoimmune skeletal, yeah, skeletal disorders and autoimmune disorders. This as a combined course starts in December, where a lot of really good clinicians across the world will be joining us. But we will discuss about that a little later.
Okay. Thank you so much, sir, for this good introduction about the disease and how important they are to treat now. And can you tell us, in a simpler words, if we have some general audience too, What are autoimmune disorders and how do we suffer from those?
Yeah, basically, if I have to tell you in a very, very laymanist destroying our own body cells. So that is the main crux of it, where they cannot sense the difference between, let's say, a cell from our own body and something from outside. In short, if I have to give you a more easier example, imagine the army or the police, instead of killing the enemy countries, they start killing the people inside the country. So this is what actually happens, and this can go in a kind of a chaotic state where there is a destruction, different parts of the body, different cells, different cellular pathology gets affected. And the modern medicine actually hasn't been exactly able to find out what is the reason of it. And and the real reason of it, of course, more and more researchers show has a root cause on 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 the aspect of psychosomatism, on the aspect of lifestyle, on the aspect of a lot of vaccinations done in the past. So these have all multifactorial origin. Unfortunately, I can't hear you. Hmm.
Can you hear me now?
I can hear you now. Yes.
Ah, okay. So, how homeopathy approaches such diseases in a more effective manner and in a more more sensible ways.
See, basically, of course, in homeopathy, the secret of homeopathy, one of the most important laws is individualization. You will be,
Mm,
in any case, whether it's a cough case or a cancer case, you still want to individualize the case at the deepest level and still, according to the Hahnemannian principles, form a portrait of disease and find the remedy for the person, or as Kent beautifully said, find the man in the disease, in that direction. But of course, with a lot of experiences now, and when I talk about experience, I don't only speak about my own self, but we are a team of many good homeopathic doctors from India, from other countries, from Switzerland, from Russia, from the UK, from Croatia, and we have seen certain cases and we have had certain experiences where you have to be much more broader in the way of analyzing cases, where you need to be multi kind of dimensional in the kind of prescription, which means that you might give an individual remedy, but it may not always help till the entire aspect. And at some point in the case, a SAR code might be needed. Um, in some case, in some particular area of the case, maybe a kind of a deeper anti-miasmatic remedy may be required. So one has to be very open to a very open, multi-dimensional, flexible approach, and that's what we have devised, and the results are quite heartwarming and just something that our colleagues could also benefit from this and take the best advantage of this.
sure. So, is there any particular autoimmune cases where homeopathy works best, or is it applicable to all the cases?
There was a don't know if you have ever heard about him. Uh, He has written a very nice book on vitiligo, on skin disorders.
So you're not
Vitiligo
audible
or
to me.
something like that. Okay.
It's
Any better?
yeah, yeah, it's
Okay.
better now.
Perfect. So I was saying that there was a great homeopath from Mumbai, Dr. Sarabhai Kapadia. I was telling you this, that he has written a very nice book on skin disorders. It's a very rare book. And he was the teacher of teachers, he was a teacher of people like Dr. Sankaran, people like Farooq Master, all these people's teacher. So we are talking about a different generation. And he would say this, and I like what he said. He would say this, that, and I have this book in my clinic. There's this in the clinic. I like to store some very old literatures. He would say this, that any type of case in this world. Homeopathy has in it the potential to help the is the Wi-Fi very affected? Let me try again.
So, meanwhile, you can ask your questions in the comments, and he'll be joining us again. Um, apps are down, and you can keep asking your questions. And if you want to see the such live sessions with other doctors too, follow us for that. Let me connect him again. So,
Yeah,
yes, so we can continue.
perfect. So I was talking to you about one of the greatest homeopaths from India, Sarabhai Kapadia, and he said that any type of case, any type of disease, any type of pathology, homeopathy has the potential to help the suffering. Till what extent depends a lot on the type of disease, depends a lot on the susceptibility of the patient, depends a lot on so many factors, but it has it in it, whatever the name of the disease, to help the suffering. And this I believed in, and this is something that I have experienced. I'm pretty sure a lot of really good classical homeopaths have also experienced.
Uh, we have a question. Is there any standard approach, example, to begin with anti-miasmatic remedies? If yes, then which are the remedies? This is the question.
There is the most important thing that one has to understand is that there is nothing called a standard in homeopathy. Okay, you can't call any approach as a standard approach. Okay,
Yeah.
homeopathy is a much broader kind of aspect, and of course there are many approaches in it, as we already know, different approaches, whether it's the Kentian, Boger, Bonninghausen, or you're talking about a more pathological approach, or Burnett's approach, or you're talking about more of approach based on mind method, or we are talking about thematic approaches, and so much, huh? So many different approaches. So I believe that the approach is actually decided by the patient, and the patient's state decides the approach. So in some case, you might give a totally pathological prescription. Or in another case, you might have to prescribe based on the subconscious state and a dream. So one has to be open towards it. In a particular case, autoimmune disorder, only the kidney is affected, and the only symptom you have is the proteinuria. You don't have anything else. So proteinuria with a lot of soreness of the kidney, you would think about a remedy like Solidago, for example, in a very low potency. In another case, you might analyze the case and you might get a very entire state. This person talks about the dreams of being pursued. He talks about kind of someone coming from behind and attacking, and the person getting a feeling of a kind of a backstab and betraying, and a person who's very clairvoyant. You might straight away think about a remedy like Crotalus cascavella, so the Brazilian snake. So one has to be open to both the approaches, and I believe that flexibility um, is a very important part of any type of state, any type of approach that one does.
Yeah. Uh, there is a, I guess he's a patient. I'm not able to guess it correctly, but he said homeopathy works for the case, many incurable cases wonderfully. But he has been given 20 plus remedies and far nothing worked. So how would you start Sarcode, no sods? I'm your patient though.
Yeah, I wouldn't know offhand, but the most important thing would be to still be patient in treating such kind of cases. And different cases can have a different timeline of healing. a much longer time to heal. And in some cases, you might see a result within 2 weeks. Some cases may require more than 2, 3, 4, 5 years, depending on the type of disease and the type of pathology that you're treating. So one has to have the patience, the openness, and the flexibility in treating such kind of cases.
Yeah. Uh, my another question is when patient is coming from conventional treatment, they are taking a conventional treatment and they are thinking of approaching homeopathy for their autoimmune disorders. Then how can we first, what should be our first approach for those patients who are like habitual of getting instant reliefs from the anti-inflammatory medicines? And what should be our approach in those cases?
I do believe that a lot of importance should be given to education. So generally, if the patient is at that kind of level where you can actually educate the patient, I think it's a good idea if we can educate the patients, tell them about what autoimmune diseases and how homeopathy has a kind of a potential to be. So educating and creating awareness is a very important kind of part. And the other very important part, which I also believe is that in many of these cases where the patient is taking a lot of allopathic medicines, I don't think that you can just on the first day stop all the allopathic medicines. I think they have to be tapered down gradually, and you have to take the patient in confidence and handhold the patient towards this healing process, I believe. And
Okay.
and finally, a very important part is that many times what we often do is that if a patient is taking a particular allopathic medicine for a very long time, let's say um, um, if a patient is taking prednisolone for a long time, okay, like 10 years or something, we could often in homeopathy give prednisolone in a potentized dose. So this technique is called as tautopathy. This was started by another great legendary homeopath called as R.P. Patel. There is a nice book by him, which is red in color, small book, Tautopathy by R.P. Patel. So he started working on this, and now many homeopaths are using this, for example, chemotherapy, etc. So this tautopathy is something that you could often use in musculoskeletal disorders, in autoimmune disorders, in hormonal disorders. So we are using a lot of remedies like cortisone 30, adrenal cortex 30, remedies like methotrexate 30, for example, or estrogen or testosterone 30. I use it at a day-to-day practice, and quite fascinating to see results. Homeopathy is growing quite a lot, doctor. And one of my feeling that I get very often is that sometimes we are fixed. We are in a state of thuja. We are fixed. यही है. Homeopathy is only Allen's keynote. Homeopathy is only Boric. So I feel that, of course, Allen's keynote and Boric and Kent repertory, and this is all part of something that is a heritage part of homeopathy, and we have to master it. But homeopathy is much beyond only one or two books, is what I see, because when one travels, one learns a lot and one evolves a lot. Homeopathy has gone beyond just one or two books, and there is a lot to do, lot to explore at a day-to-day level. And at this moment, I'm learning and reading so many newer literatures because we can't be fixed. The disease patterns are changing. What Hahnemann spoke so many years back is true, totally true. But remember, he wrote 6 editions, 5 or 6 editions in Organon in his own timeline. Imagine if he was present now, he would have come out with the 100th edition of today's time. So one has to kind of innovate and be in today's times and evolve. And that's the reason that we are taking the education very seriously. Ours is the one of the only academies which kind of connects the old classical homeopathy to the newer approaches, and that's what we do in our online courses and in our seminars that we do. That's the
Yeah. This is, I guess, some of
don't go in a
one of
state
the
of fixed
main
state.
reason.
Yeah,
So your network broke, I guess. So I was
yeah,
saying this is the main reason why I came up with this series. Like we should invite people around the world, and we should at least provide some sort of knowledge or some sort of topic every week. So there
absolutely.
is always growth in the knowledge.
Yeah, yeah.
So
It's
I learned about
true.
autopathy today. So it was something new for me today.
There is a lot to learn, doctor. It's just
Yeah.
quite fascinating. We have to get out of mindset where we are kind of, I see this in homeopaths, unfortunately, a lot of homeopaths that we are, and I put myself in the same category that we are fixed, we are fixed in our own state and we don't want to grow out of it due to very petty things. And I think that um, we have to grow beyond and above this and evolve ourselves if we really want to grow, because that is where the real peace, contentment, and success is. And I think that's what we really want in our life.
And I guess reading helps a lot. If you read, you grow.
Absolutely. Absolutely.
Yeah. So,
I mean, they say that if at one point you do not have about 20 or 25 books kept in your clinic or in your house that you have to read more, then you have not started your life till now. So at this moment, I already know about 30, 40 books that I know that I need to read, which I haven't read. I know it's there in the back of my mind, here I know I have to read these books. And if it's not there in your mind, then something is missing. And our growth is stagnated. And that is something that I feel that for our homeopath, that we should keep growing, we should keep evolving and not get fixed, not get into that story. कि यही है बस. I know that some of our homeopaths like to say, no, this is it, only this book, and then that's it. It's not like that. Much beyond it, much beyond that, our imaginations can possibly be.
yeah. So there is another question. Sir, can you tell us about lichen planus?
What do I say about lichen planus? Lichen planus is a type of a disease in skin pathology. What I can tell you is that homeopathy has a very good scope in it. And
Mm.
and it may look sometimes like psoriasis. I've personally treated some of them. I had a case a few years back. Uh, the lichen planus that she had was on her limbs, and it was bluish in color. That was a peculiarity. It was a bluish tinge. And when I studied her case, one of the symptoms that she had was she would constantly get dreams of a black cobra, constantly. And the peculiarity was that she wouldn't get scared of it. And I, I don't remember everything about the case, but I studied and I gave her the remedy Naja. And within 2 weeks, it totally kind of disappeared. So,
Wonderful.
so yeah. So you would see this kind of things happening as well.
You see all kinds of wonders in homeopathy.
Yeah. It, it it's a fascinating science.
Exactly. She again asked, like, is there any relapses after taking homeopathic medicines?
Just like any other, no? Relapses can happen in any diseases, in any type of pathologies, whether it's any kind of healing um, profession. Because the reason of a relapse can be so many. It could be just part of the disease. It could be an exciting factor, maybe certain emotional factors or certain physical factors can can play a role. But relapses can happen. It's a good opportunity as a homeopath to review the case and analyze the case and then plan the next. Very kind of circumspect. I will give you an example. Okay, so I was treating a case of a patient who has a headache, migraine. So I studied her case and I gave her the remedy natrum carb. Okay, the indications of natrum carb. But she came yesterday to meet me, and she said that okay, Natram. She said okay, all this is okay, but doctor, I want to meet you urgently because I'm getting the headache and my mind state is not so good. And I said okay. One thing is you can close your eyes and say okay, take Natram carb again, come next time. But this is what I call as a chalta hai homeopathy. This doesn't work. If a person is coming and telling you certain kind of thing, you want to evaluate again. I'm not talking about a result. I'm talking about the process. You want to evaluate again. So now you're evaluating the case history again. And what I found something very beautiful and interesting for me is that I went deeper in her subconscious state, and her main experience, she says, is that doctor, I feel totally trapped. I feel totally trapped. I feel totally kind of abused. I feel totally dominated, and I want to just break free and escape from this. And I just want freedom, you know. I feel मैं अटक गई हूँ और मुझे I want a total freedom. Uh, I want to just get out of this, and I'm not able to get out of this. And this is my feeling that they are doing this to me, and you know, I feel like a prisoner. I feel like I'm totally trapped, suffocated. What do I do? I knew this that this is not natrum carbonicum. I hope you can hear me.
Yeah, we can.
This is not natrum carb. I knew this. So I started analyzing the case again. I started repertorizing the case again. I started studying the case again. And it was a beautiful case of a remedy Falco P. It's a raptor. Okay, this remedy. Now, one has to be open to this possibility. This is the this is homeopathy. You know, a lot of our young friends are joined here.
Yeah.
The secret of homeopath and a homeopathic process is an adventure. When you are with a patient, you cannot think I am going to give this and that. You have to take the patient in her deeper state, which you also don't know and patient also doesn't know, and then go deeper and see what comes up, which you should have no clue about. So if you ask me what remedy you're going to give for this autoimmune disorder, I would say I don't know because her state I wouldn't know, and I will have to explore that with her in detail. And that is it, you know, the homeopathic process of case taking should be taken like for a homeopath, you know, it should be like an adventure, something that you don't know about, but you want to go more and more and more deeper and find. This is the beauty actually, and that's why every day, you know, sometimes I feel again I have to go to the clinic, I have to see so many patients, but for me, while I'm going to the clinic, I'm excited because I don't know what's going to happen today. I have no clue what this patient is going to talk and what he's going to say and what remedy I'm going to find for this patient. That is the beauty of it, of not knowing. And that's why it's so amazing to be a homeopath.
And there is one, I guess she's starting homeopathy, Abhi. So
Yeah.
which book we should read in early days of practice?
First of all, I want to tell you to my friend here who's asked the question is that there is no early, there is no late. We are all in the same boat. Okay. So if you feel that you're early and someone else is a little late, trust me, we are in the same boat. Once you have just jumped in the sea, you are in the sea. We are all in the same sea now. But of course, you want to start with the basic books, you know. You want to start with something like one of my favorite books I tell my friends is N.M. Chaudhary, you know. I think B. Jain makes this book. I recently,
Yeah.
Mr. Manish met me at one of the seminars in Delhi where we had done it and he had come as a guest also. I was telling him that many older books, older literatures, B. Jain should republish because they are so important. And I keep talking about these older books, which I feel that should be part of this thing. Of course, N.M. Chaudhary is one of the first book that I will tell my colleagues. Another book that I like a lot. I still read it, but I like this book a lot. I think this is also B. Jain book, but I like it. This I feel is the most underused book, but this is a beautiful book. This is called as Plain Talks on Materia Medica by Williard Pierce. It's an absolutely amazing book. Absolutely amazing. This is a book that I'm reading a lot, but is a top class book because it's a little bit like N.M. Chaudhary, but it puts together many things together. So this book, of course, you want to read Organon. Of course, you want to read the basics of repertory. And of course, you want to read more Materia Medica books, starting from Alan Skino to Nash to Farrington to Tyler to Dunham to Clark. The list can go on. All the list of books which are behind me. So, but one has to be also open to newer books. For example, this book that I recently read. This is a book, very beautiful book by Rima Hadley about Hahnemann's real life. You know how he was as a homeopath. You know, to to another literature which I'm reading a lot. This is again not available so much in India. This is Massimo Mangiamori from Italy, where he talks about a lot of his clinical cases. Totally fascinating. Totally another book. You want to be in today's on, wondrous plant. So one has to be a student for life. That is the idea.
Always. Meanwhile, we are answering questions. There is another question. Medicines like cortisone and renal cortex, new
Not renal cortex.
remedies as well as
I'll just recorrect. It's adrenal cortex. Okay.
renal,
So
yes.
that
Uh, are these well proven, or are these deep acting remedies, and are these state remedies? I don't
yeah,
understand
yeah,
the question.
I will try to answer some part of it. Okay, this is one of the books that I have. Uh, where is the book? Yeah, my 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 house is in a bit of a book mess. Okay, if you come to my house, it will be a little crazy for you. So yeah, this is the book that I've written. This is a book, the first version of the book, Materia Medica of nosodes, sarcodes, and bowel nosodes. Have you seen this book before? Have you read this book, doctor?
No,
Yourself?
no,
No? And of course, this is
but
this is
I
the
would love
Portuguese.
to.
Okay, okay. This is the Portuguese version of the same book, nosode, sarcode, bowel nosode, and there is a French and there is a Russian. So a lot of these nosodes, sarcode, bowel nosodes are very actually quite well clinically verified, and a lot of advanced homeopaths of today's times are using this quite well in the of clinically verified symptoms, which are also worth noting that we have confirmed, and I've written in detail about it. For example, cortisol. Unfortunately, I don't have a Zoom kind of a network, so I could have opened the provings and shown to you, cortisone, or I would have done that for you, no problem. But I will, because you have asked, and I don't mind sharing a little bit about sarcodes. First of all, we should know what's a sarcode. Okay.
Yes,
Sarcode, as you know, is a remedy that's prepared from a healthy living tissue. We already know about remedy like thyroidinum. It's a very well-known sarcode. Homeopaths for so many years have been using it, for example. So it's a very well-known sarcode, but there are many, many more sarcodes. Cortisone is a is quite an interesting remedy. And when you want to understand a remedy, you have to understand at three levels. The first level is the source. Okay, that is where it's coming from. So cortisone is what? Cortisol. Cortisol is a kind of a transmitter in our body, right? Neurotransmitter, enzyme, whatever you want to call it. And when does it come up? That's the first thing. When does the cortisol come up? When does the cortisol increase in our body? What do you think?
that's during stress.
During stress. Very, very well said. So flight and fright reaction, any kind of stressful situation, it'll go on. It'll kind of increase. And what will you do then? You want to run, my God! You want to run, you want to escape. I shouldn't shout because then my mother will come and she'll feel, kya ho gaya yahan pe? Yeah. So, so that is also a state of cortisone at a deeper level. The state of cortisone may look a little bit like solanacy of stramonium, where there is a kind of a state of flight and fright reaction. So these people are very fast-paced people, and the sarcodes in general can be fast-paced remedies, like, for example, sulfuric acid or tarantula. So cortisone has a very nice rubric. They cannot tolerate anyone being very, very slow, like tarantula. So there is a very nice rubric there that they get very angry if someone is very, very slow. So this is one very important symptom. Of course, there is a lot of more provings done. Cortisone is very, very important for a lot of hormonal disorders like thyroid disorders, PCOD. In PCOD, for example, uh, there is a hump, buffalo hump, there is a moon phase, there is a kind of obesity, allergies, urticaria. OA Gillian has written very beautifully about cortisone. So this is one of the remedies, but there are so many sarcodes that we are using now. Insulinum, for example, we already know about it. We are using rampantly in many, many complicated cases of diabetic ulcers, diabetic neuropathy. In fact, there is a proving of insulin also. Okay, if you read Dr. P. Sankaran and Matani, these two people very useful in general in all cases with diabetes because it balances the blood sugar when especially given along with the indicated remedy. So this is many sarcodes like that, it's quite fascinating. There is a sarcode, for example, which is prepared from testes. For example, you can read Clark, you'll find testes. So this is a remedy I use a lot in cases of impotency, in cases with sexual issues, male sexual issues, for growth issues. So sarcodes, bowel nosodes, rare nosodes, tautopathic remedy. Without that, in today's
So we had like a very interesting discussion, and there were so many of live questions, and we had a lot of questions which I asked today.
yeah.
They were from the story we I posted yesterday, and they
All
asked
right, all right.
questions in the story. So actually, I wanted to it's a compliment. I like when I talk to people like speakers, it has been like 3, 4 months now, and there are some speakers who have a spark in their eyes when they are talking about homeopathy. So I saw that, and it's very fascinating.
Yeah. You'll see that with you'll see that with people who are very fascinated by homeopathy, but you'll
Yeah,
also see that with people in in whose life, homeopathy has a, and for me personally, uh, uh, you know, I'm so grateful to homeopathy because not just as a profession, but at a personal level, it's a huge part of one's life.
yeah,
And
yeah,
homeopathy is not only a art and science and a profession. Sometimes being a homeopath becomes a part of you. It's just a way of life. It's like that. Just how yoga is a way of life.
yeah,
Just doing 2 or 3 stretches is not going to make you a yoga or a yogi. Similarly, being a homeopath, you start seeing things in an individualistic way. You start sensing energies differently. It becomes part of you, and I'm sure you must have kind of also experienced this, that
yeah,
being a homeopath is not just about a degree or knowing 1 or 2 books. So it's a way of thinking, way of experiencing, and it's we are very destined to be homeopaths. Um, I was just last in France in Marseille, and I was teaching, and there was a large group of people, and in Europe, in many countries, homeopathy is kind of attacked. And when I say attacked, means like properly attacked. Okay, they make it difficult for them to practice homeopathy, for example, in some countries, of course, not in some other countries. But they all look forward to India. When I go there, when I see the patient, they talk about India as a, like a mother India, because they talk about India as a leader in homeopathy. And that's why I feel it's also to an extent a responsibility, because homeopathy to an extent has a big role in India, and Indian homeopaths have a big role, I feel personally, because they have to take it to the next level, because it's so easily for us to practice, to live, to do what we want to do, to treat the kind of cases we are treating, the kind of freedom that we have in our country in context of homeopathy, due to so many things. It's just I cannot tell you how much they look forward to it, how much they crave it, and they look forward to learn everything when we talk about all the homeopathic approach. They are just fascinated by it. So there's also a bit of a responsibility on us to grow and evolve and take it to the next level.
yeah. So I think we covered a lot of questions and too many of queries. But I wanted to ask this final question. This one is mine.
Okay.
I want to know about a case of autoimmune disorders which you remember to your core, like that was really fascinating or a wonderful case.
Yeah.
One
The
case.
only Yeah, the only problem is that if you ask me a case that I might have seen yesterday, I still won't be able to tell you like a case in total. Of course, I will tell you something that I remember about the case, but I won't be able to really, like, this is a little bit of a problem with my memory, that I forget the whole story of the case. I'll tell you just one, but at a broad level,
I guess
doctor.
just
Um,
peculiarities, some peculiarity
of
or some like
course, I will.
the hook point will work.
Yeah, 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 yeah. Actually, there are so many cases, no? I'm just thinking which case do I tell you, but I will still tell you. So there is this very interesting case of ophthalmic pathology. It was a case of a kind of a Wegener's granulomatosis where the patient had a ear issue, a patient had eye issue, and so on. And we were studying his case. I'm treating him for 2, 3 years, but we were not able to crack the case. We were not able to find the case because I gave him one or two remedies without so much of a change. This also kind of talks to us about how one has to be open enough for one's failures in treatment. When I studied the case, what I remembered, what I found very peculiar about him is that he says that, doctor, I have a lot of strength. If you tell me, even with this problems with the eye, with the ear, with this weakness, this thing, I can run for 3 hours in the morning and 3 hours in the evening. I said, but you're not well. How? He said, no, I have that stamina, doctor. I am very strong. I'm very perseverant. I'm very positive. I know that I can do it. I totally trust you. I said, my God. So his state was very intense, very positive, very perseverant, very kind of very high stamina, a lot of high energy, and 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 in anything always right. I know I can do it. So when I analyzed the case, was a very beautiful case of ferrum metallicum. This is the state of ferrum metallicum. Ferrum is iron. Okay, they are the most positive, most perseverant people with highest stamina and very positive, over positive. हो जाएगा. This sometime you meet some people, no, that will this happen? हो जाएगा sir. They could be ferrum, and they actually do it also. If they just talk and they won't do it, then that's another remedy. But and they are this kind of, they are the iron men. So they will keep working, very consistent, very perfect. And he considerably did well. Of course, little later, because he was previously on steroids, I had to give cortisone for some time to remove the side effects of the steroids and so on. But this is one of the cases that I remember offhand. But the idea is, whether it's autoimmune, hormonal disease, cough, cancer, you still have to individualize and prescribe based on the state. Before you end, I just want to invite my colleague. I told you my colleague, Dr. Srishti, would be joining because she wanted to announce something. Let's see if you can find her and you can send an invite. Her name
Okay.
is Dr. Srishti Bhandari. She's part of our academy. She's the dean of our academy, actually. I'm just seeing if she can join. Meanwhile,
Yeah.
if there is
Sir,
any other question, I can take.
I, I accepted her request, but there is one question. Someone want to get your book on sarcoids, so where they can find it?
They can just email me. So my email ID, you can put it a little later in the chat. Anyone wants to know about the book or about the
Yeah.
courses or whatever, you can write an email to me, gaurangedg@gmail.com, which you already have. You sent me an invite based on that. So this is my colleague, Dr. Srishti. She is based in Delhi only, somewhere close to where our host is, hopefully. And
Hi, how are
she,
you?
Hello. Yes, I'm good. How are
yeah,
you,
so
doctor?
so she had come to Mumbai and she my cases and
Oh,
she's studying with me and now she's
network
also
error.
part of our. Can you hear me?
Yeah,
Yes.
we can hear you now.
Yeah, so she had come and now she's part of our academy and a part of our clinic and she's helping me solve some difficult cases. She follows up with them and she studies them and also she's part of the academy. She's the person who manages the courses. So, so our new course, which is on autoimmune disorders and musculoskeletal disorders, which will be starting in December. And we have put together and invited some absolutely amazing teachers, including Dr. Gajanan, Dr. Borkar from India, Dr. Sarkar, and even colleagues from UK, Jonathan Hardy, and a colleague from Croatia, a colleague from UK. So we have put together the best homeopaths from different part of the world with different approaches, talking about autoimmune and musculoskeletal disorders. This is a 30 hours course with 20 lectures on weekends. You get an access for 2 years, and the fee trouser or on a dinner. So this is something that is open to all of you. And yeah, maybe Dr. Srishti, being the main think tank behind all of this, she can share some things. Yes, Dr. Srishti. I think you know each other by some way.
Yes.
I might.
Yeah, so as I was watching the live, also many of our today's viewer have asked about approach in autoimmune diseases and what role homeopathy can play, and also as we see like nowadays musculoskeletal disorders like arthritis, gout, all are increasing exponentially. So this is why also with our clinic discussion and for those who are a part of our academy since long, we have come up with the new course, homeopathic strategies in musculoskeletal and autoimmune disorders. And in this course, we'll be discussing, along with Dr. Gaurang sir, we have invited various international speakers, best Indian homeopaths, like sir have already mentioned, Dr. Jonathan Hardy, Dr. Sarkar sir, and Dr. Gajanan sir. So everyone will be sharing their experience. We have topics like degenerative bone disorders, joint disorders, arthritis, autoimmune disorders like rheumatoid arthritis and SLE. So many of these topics, which are very important nowadays, we see a lot in clinical practice are being covered in this course, as well as because we know that how important it is to also learn about the prognosis and differential diagnosis. We'll be inviting a orthopedic who will be taking a session on clinical aspect of the skeletal disorders, talking about diagnosis, investigations, and how do we check and see the prognosis of the case with the homeopathy. And again, as I have worked with sir and I'm working with sir, we know about the integrative method of healing. So along with homeopathy, in such cases, rehabilitation and physiotherapy plays a very important role. So we will also be having session on physiotherapy and rehabilitation with a certified physiotherapist. So this is a very, I think, important topic in today's time, and that's why we have come up with this. And sir will be sharing about his cases, his clinical approach in all these various cases, as well as all the speakers from all around the world. So I do hope that those who have joined us today register by emailing on the email ID given. And for all the participants, they can write to us that they have attended the live with BGen, and we will be giving them a very special discount.
Yeah, so if anyone is watching this right now, you get a special discount. Just write an email on gaurang@gmail.com. Perfect. Thank you, Dr. Srishti. And
Thank you
Dr.
so
Srishti is doing really amazing with us, handling many difficult cases. And she's kind of overlooking the entire courses and academy for the last 3, 4 years and quite.
So that was a great information for all of the viewers, especially for the like students basically who are starting their journey in the homeopathy. So thank you so much, Dr. Shrishti.
Thank you, Dr. Kiran, for having me.
Yeah. So I guess we have covered all the questions people asked us. So that was really great knowing a lot of about autoimmune disorders and how homeopathy can do wonders for those cases and for those patients. So I hope everyone who joined us liked the session and the pattern of the session, because you can ask things in real time. You don't have to wait for some other time that you will get your answers. So I think people like the privilege of asking questions directly to you because it takes time otherwise.
Yeah.
And so the case was very nice. I liked
You
the
read it,
point
whatever
in a
whatever you whatever you learn today, not just you but all the colleagues, you can read about
yeah,
it and keep evolving. Don't get fixed.
yeah,
You, uh, keep evolving, keep growing. That is where the real joy is.
exactly. So sometimes I think these kind of sessions play a important part in the stimulating the learning part,
Yeah.
because I heard something today and then I'll go home and I read about it. So that should be our take from the session.
Yeah, the most important thing, doctor, is that you have to be open to it. The most important
Yeah.
thing is the mindset. Once life. Just be open. Perfect. So
So
thank you so much.
I will
Thank you for having me.
I will conclude this session here. And thank you so much, sir, for accepting this. And I think our viewers are so happy to have you. And thank you everyone who joined us. And we'll
Thank
continue
you.
this for the next week. Okay. Thank you so much, sir. Have a nice day, everyone.